Okay, hi folks, welcome to week 2 of heart disease. So let me just get this set up here. So I'm going to talk you through a couple of things for this week. Obviously last week you did your past paper question, and I know the ones that we've marked so far look pretty good, so well done. But I will make a wee separate video just as a model answer to kind of take you through it as well, so don't panic about that, we will go over it. So, what you need to know about every single disease that we study at Lanark Grammar is we need to know the causes of the disease, the impact of that disease on people and the population, and also what can we do to manage it. So the three diseases that we study are heart disease, which mainly affects more developed countries. We also look at malaria, and we also look at HIV and AIDS. Okay, so for heart disease, we need to know what causes it, what is the impact of it, and what can we do to stop people getting it in the first place, and also what can we do for people that have already got heart disease and are living with it, what can we do to make things a wee bit easier for them. So please don't panic. Although we're doing some biology, it's very, very basic. We're not doing National 5 biology, don't panic. So we need to understand the heart because we're looking at heart disease. So we're going to look at some basic fundamentals of the heart and how it operates and why it's so important to us. There's going to be a diagram on the next slide that I'd like you to copy down, but you don't need to worry about it being a work of art. Just leave enough space around it so that you can annotate it and add on some information. If you look up here, there is a video for you to watch, and it's just a brief explanation of how the heart works and how it pumps blood around your body. I mean, that's from the Mayo Clinic, so it is really, really quite good. So you've got to copy this part down here. So you've got information, you've got the slideshow available there. Copy this part down. It's a cardiac muscle. It's known as a double pump that squeezes blood around the body and to the lungs. The right side pumps blood to the lungs to pick up oxygen, and the left side pumps blood around the rest of the body. So obviously our blood needs oxygen, that's what kind of keeps all of our organs going, and it's the heart is the pump that puts everything around our body to keep it going. It is really, obviously, quite important. So this is the part where it might get a little bit confusing. I'm just going to move my Glaikit features out of the way. There we are. So when we're doing this, usually what I would do is I would stand up in front of the projector and project this image onto my own body, right? Because a lot of people get a little bit confused because there's a left side and there's a right side. But what you have to imagine is that you are looking down, so your head obviously is up here, and you're looking down at the heart. And so you've got your left side and your right side. Or if you imagine you're a surgeon, you're looking at the patient's left side and the patient's right side. And you have to be really careful about this because when these words appear around this image, it might seem a little bit confusing. So, you've got the pulmonary artery, and that takes blood to the lungs to get oxygen. So this blue blood here means it's deoxygenated. It doesn't have enough oxygen in it. So the blood that's gone around our body comes back into this part here, and it goes from this pulmonary artery to the lungs to get some oxygen. Okay, you've got the vena cava, you've got the right atrium, and then you've got the right ventricle. And you might be thinking, but hold on a minute, that's on the left side of my diagram. But you have to imagine that your head is up here and you're looking down. And so this would be on your right side. Okay, it's always the patient, right? So if you're a surgeon and they're needing to get some work done on their right atrium, you need to make sure you're going for the right one because you don't want to do an operation on a heart that you don't need to do. So we spoke about the pulmonary artery taking lungs to the oxygen. So here we get all of that nice oxygen-rich blood coming from the lungs into here, and the aorta takes it to other parts of the body. And you get your left atrium and your left ventricle. So I'd like you to copy that diagram down. Put colour in if you can. If you can't, please don't worry about it. We just need to kind of understand how this heart works. So essentially, what you've got is you've got the blood that's already gone around the body coming back in to the heart, getting pumped around. It's basically, it just keeps it going round. So it comes in here, swishes round, fired back out, and then it comes out of here and it goes into this pulmonary vein after it's been to the lungs, and it's got really nice oxygen-rich blood in there to go around the rest of the body. Okay, so this slide here is optional. You don't need to copy it down, but it might be quite helpful for you. So, just like other organs in the body, the heart also has its own blood supply. Now, this might seem a little bit odd. You're thinking, well, there's blood going through it the full time. But if we look here, it says the reason that the heart has its own supply is because it needs a lot of oxygen and nutrients to keep it working at its best. It is a organ in your body that is doing a huge amount of work, so you need to make sure that it's definitely got enough oxygen. The walls of the heart are also so thick that oxygen and nutrients cannot easily pass into where it is needed. So, there's two arteries. The artery that supplies the heart with blood is called the coronary artery. If the artery gets blocked, then the cells in the heart are going to start to run short of oxygen. The heart can't do its job properly. If this happens, then the heart will not be able to contract or squeeze. And if it can't do that, it can't pump blood around the body. A heart attack is when blood flow to the heart is blocked. And cardiac arrest is when the heart malfunctions and suddenly it stops beating. A heart attack is a circulation problem, and cardiac arrest is an electrical problem. So you've got a heart attack, your heart will still keep going, but it's just not getting enough around your body. And that's kind of what happened to my dad. But his heart was still beating, but it's just been blocked and it's not getting enough. Cardiac arrest is when the heart stops beating completely. And so that's when you need to kind of get that heart back up and going again. So really quite serious things that we'll cover in a wee bit more detail later on. So here you've got an image here. So we've obviously got blood going around the body, and what we have is we just have a couple of arteries coming off of that then feed your heart. You've got your right coronary artery and your left coronary artery. Again, left and right based on you, the patient. So we're going to start looking at coronary heart disease. Just call it heart disease, make it nice and easy. So heart disease, or CHD if you want to kid on your Grey's Anatomy like me and Miss Thompson do. So there's a wee video up here again for you to watch. There's lots of videos in this because there's so much information out there just about coronary heart disease, what it is like. So heart disease affects the pair of blood vessels which supply the heart muscle with glucose and oxygen. Glucose is sugar it requires to pump blood around the body. These are called the coronary arteries. Heart disease can be caused by an atheroma. This is the name of the fatty deposit which forms within the wall of an artery. So if we've got a very healthy artery, think of it as a tube or a drain, okay, maybe even a drain in your shower or something. And if it's clear, the water's going to run right through that. And if the artery is clear, the blood can get right through it. What might happen is we might start to get a bit of plaque building up if we've got heart disease. And we're going to look at what causes that later on. So if plaque starts to build up in this region, the blood flow is going to be restricted. Think of your drain. If you get stuff in your drain, the water getting out of it is going to be restricted. So this part here, where we've got a blocked artery to the extent where the blood flow is really, really reduced, this is known as an atheroma. Okay, so what I'd like you to do is copy these diagrams under your notes, just as best you can, to show how an artery eventually becomes blocked. These are the issues. We need to stop these happening, or we need to figure out a way later on in the unit, a way that we could maybe get rid of this blocked artery and prevent it from happening again. So there's different stages to heart disease, and this is what we're going to be looking at as well. So I'd like you to copy this down into your notes. So fatty deposits begin to gather in the artery. These deposits begin to form plaque, not the same kind of plaque that you get on your teeth, okay? The plaque bulges into the artery, which restricts the flow of the blood. And when the blood flow is restricted, when the blood flow is restricted, the blood pressure increases. So your heart starts working a little bit harder. It says, why is the blood not getting through here? I need to work a little bit harder to try and get that blood through that blocked artery. So blood pressure is the force used by your heart to pump blood, and that goes up when the flow is restricted. And that higher blood pressure can cause further damage to the artery. What can happen is your blood cells can actually start to batter the artery and take little chunks out of it, and the plaque will build up as a way to almost kind of repair itself, so that can cause even more damage to the artery. So it's really important that if you've got high blood pressure, you get that checked out. And you know one of the careers with the highest blood pressure on average? Teaching. Are you surprised? So we need to have a think about what are the consequences of heart disease on the human body. So just make a wee simple diagram of this, a wee stick man will do, and stick it in. So one of the things that heart disease can cause is a stroke, and that is very, very serious. One of my friends, Hannah, she is a doctor, and part of her research, she works out in America now, is looking at how heart disease is linked to strokes and what causes strokes, and if there's any early warning signs that people could maybe get to earlier. So it's really, really important, and there's a lot of work still going into that. Another thing is vision loss. Often people with severe heart disease will require glasses. Heart failure, obviously, because your heart will start to degenerate. Heart attack is another symptom. You can get kidney disease and failure. And another one is sexual dysfunction, which usually gets a wee laugh in class. If you want a wee chuckle, have a wee chuckle at that. So, I'd like you to copy this down as well. If we're looking at the consequences, we need to think about heart attacks. So we've got a reduced blood flow is going to result in less oxygen getting to the muscle of the heart. This can stop the heart from pumping properly, or it can actually stop it from pumping completely. This is known as a heart attack. An aneurysm is slightly different. So we've got those fatty deposits building up, building up, building up. Weakened areas start to swell up like little balloons. So you get a little balloon here filling up, a little balloon full of blood, and eventually that can pop. So they burst, that can cause blood loss, and if this happens in the arteries that feed the brain, blocked and burst arteries can cause strokes or death. Actually, one of my friends, Laura, her mum had a brain aneurysm, which is really serious, and she managed to survive it. The survival rate for a brain aneurysm is very, very, very low. And it's also one of the symptoms of heart disease that you can get. So on that cheery thought, let's have a look at what a healthy heart should look like out of a healthy cadaver. So, nice pinky colour. Over here, you've got your damaged heart. All of these kind of yellow fatty deposits are areas where the heart has just not been able to cope. If you actually click on these images here, they'll actually take you to a wee website with more information, and there's a wee video here about, it's from the British Heart Foundation, about kind of the sudden aspect of heart disease, about how it is so ruthless and that people can die very, very quickly. So, you don't need to copy this slide down, but it's quite useful. There's information up here about what happens during a heart attack from a TEDx talk. I think that video is about 5 minutes long. It's just quite handy to know. So, heart attack symptoms. Chest pain. So this is what most people expect, but is often mistaken for heartburn. It can range from mild to severe, and it can sometimes feel like pressure on the chest or discomfort. It's really important that you know your family history around heart disease, because my dad thought he genuinely thought he had just really bad heartburn and was convinced that he didn't need to go to the hospital. And luckily for him, one of his colleagues actually phoned an ambulance and told him to get in the ambulance. So you need to be really careful. Scottish people have got this thing about, oh, I'm fine, I'll get on with it. But, paramedics would rather come out to somebody with really severe heartburn and they're okay, than somebody with, somebody has a heart attack and they don't even realise it, okay? Pain can sometimes be felt across the body during a heart attack. Often, for men mostly, it's felt in the shoulders, one or both arms, the jaw, and even the stomach. So symptoms can range. Women often experience nausea and vomiting, but this can sometimes happen in men. Many people also break out in a cold sweat. So it's really, really careful that you know the symptoms. Many people start to experience a shortness of breath, and many people start to feel light-headed or dizzy. They can start to feel really tired, fatigued. So it is really important that you know those symptoms. What can you do in this situation? There's always something you can do. If you suspect someone is having a heart attack, do not wait. Just phone 999 and ask for an ambulance. Okay? 40 to 50% of heart attacks end in death, which is terrifying. This can be reduced. Never, ever, ever ignore the symptoms. While waiting for an ambulance, it may help to chew and then swallow a tablet of aspirin, as long as the person having the heart attack isn't allergic. Let's not make things worse here, okay? So, if somebody say one of your parents is having a heart attack, you're the only person with them, you phone 999, get them to sit down and get an aspirin and get them to chew it. might seem a bit weird why they're not just swallowing it. Get them to chew it, it digests it more quickly. And what an aspirin does is it thins the blood, so it means that the blood travels through the body a lot easier. So the aspirin helps to thin the blood and ease the flow of blood around the body. Now, if someone collapses and their heart has stopped, again, don't wait, call 999. Start hand compressions or CPR for 100 to 120 pushes per minute. This is what you're aiming for. And the 999 call handler will talk you through it. Use a defibrillator if one is nearby, and you'll start to see more and more of these pop up around the joint. Health centres have got them. I know Tesco and Lanark's got one actually. And if you watch this video here, it will show you the step-by-step process and how these work. They're actually really, really good. They're very simple to use. They actually speak to you. They give you out instructions, the actual machine itself. So they're really, really good. If you watch this wee video up here, it's about CPR with Carol Smiley. And it's just a wee fun video about just how simple it is to do CPR if you have to. So that is all for this week. It's a nice wee short, easy week. And your homework is to find out facts about heart disease. So I've put that in your scheme of work. So if you could do that, you can write it as an essay if you like. You can just bullet point it, but 15 facts about heart disease. It can be from anywhere in the world. You might want to focus on some area that you find quite interesting, maybe in Scotland, how's it changed, things like that. There is a lot of research right now around black women and heart attacks and how often their symptoms are very different, and they might go into hospitals, particularly in the USA, and they're maybe not treated with the same amount of seriousness as other people, and by that point they realise it's a heart attack. It can often be too late, so you might want to have a look into something like that. So, next week we're going to be looking at the causes of heart disease in a wee bit more detail. Alright, hope you have a good week, and I hope you enjoyed Latimer's. Cheerio.